Well, um, so hopefully everybody's on. Susan's still muted, but we'll bring her in as well. So each of you has different experiences with Huntington's disease and family members. So again, I have different questions for you all. This should be pretty much a casual kind of free discussion. So I'm going to sort of give each of you questions to sort of start a conversation. We've got about a half an hour. And I know last time it sort of ran a little bit over, but we can, after that, we'll have our next panel. But I want to just sort of raise a few questions that come up for a lot of our patients. And I think each of you have unique experiences. So I'm not sure who wants to start or where should we start? There we have Susan. Great.
I know
Thank
that.
you. We got you on here. All right. Okay. Um, I'm not sure where to start. Maybe I'll start with Marcia. So just to begin with here, okay? Is that all right?
That's fine with
Um,
me.
yeah, that's great. All right. So Marcia, we know your family well. You don't have to go into very specifics here, but um, what I wanted to ask you really are, just about your family's gone through a lot with genetic testing, and I wanted to talk to you. So we've kind of had a genetics discussion briefly and a lot of stuff, but one of the questions I wanted to ask was really deciding to get tested. And I think each of you could probably weigh in on this. So what made you all decide to kind of get tested? What motivated you all to do that? And kind of what were the issues behind the testing? It can be an emotional thing to kind of go through and decide that. So I want us to help other patients who are thinking about testing and wanting to go through the whole process.
I'll start if that's okay.
Sure.
Um, our journey, our family's journey really began back in 2018 when my husband's niece passed away of this disease called Huntington's, which we knew nothing about and we pretty much ignored it. Um, and then back in maybe a year or two later, you were introduced to the first member of our family, who was my husband's nephew, different brother, who presented to your clinic, had testing, and was diagnosed positive with Huntington's, and he was in fact symptomatic at that point. You also did an entire genetic testing for his family and found out that my husband's oldest brother was also positive for Huntington's. So all three of those family members have since passed. The latest one happened earlier this year. Um, at that point, I did a lot of research and I was a healthcare provider. So I got really involved in it. And because of the 50% chance, I was pretty insistent with my husband, who is the third brother out of four, get tested. He is prodromal, pre-symptomatic. Um, and so he did get tested in 2023 and he came back positive for HD. I have three children. And so, of course, my panic ensued because my husband is 70 and he's lived a great life. I have a 30, a 38, and a 41-year-old son. And to me, it was important that at least they have the understanding of what's going on, mainly for purposes of if they decide to have children. The first to be tested was my oldest. He got tested also at a center of excellence. He came back negative. We donated a lot to church that year, thinking that maybe this was a sign. My youngest, who's my daughter, ended up next. And she unfortunately tested positive. And to date, she has the highest repetition number, which I guess from the information I got today is very, very common. That males passing to females is not uncommon for the increase in number.
Yeah.
The last to be tested was my younger son, and he unfortunately also tested positive for HD. On the positive side for me, I've kind of gone through the grief of this happening to my family, and I am able to better communicate. I don't cry a lot anymore, and I'm on the early side of being a caregiver. I consider my role right now as just somebody who is watching my family, pretty much their eyes and ears in terms of not necessarily looking for symptoms, but if something shows up, then I kind of go from there. And Dr. McFarland, I did have to. I'm not sure if you saw my email or not, but on Thursday, the third generation tested positive, and so
Yeah.
we are now 3 generations deep. Um, he's a grandchild of Tim's oldest brother, and he in fact tested positive and got his results on Thursday. So we're now 3 generations deep,
Wow.
all currently asymptomatic. Um, but he did it also because he's getting married next month, and wanted to make sure that his future wife was aware of the situation.
Yeah. Wow. That is
Wow.
a amazing story, but I think yours is not. Um, yours is a really good example of a very large family and how this really impacts not just, you know, the individual, but all family members and children and offspring. There, your family was a little bit of a special case in terms of the testing, as there was actually
Yes,
some issues with initial testing with one of the family members, and we had to do a separate um, go to a separate company for testing because of differences in testing. So generally speaking, testing is pretty, it's routine. It's a CLIA approved testing all around the country for several sites. But um, testing sites do use what are called different primers, and we've had some rare, very rare instances where testing comes up negative or
Three
falsely negative, and
generations
that
of it.
happened for you. Yeah. So,
Grandchance,
but
just
again, your story and your family story is really incredible. So how did you, I mean, how was the experience with testing and receiving results for you all?
I I I think because we were prepared. Myself and my children were truly prepared for whatever
Yeah.
result we got. And
Yeah.
two of them did it virtually, which was wonderful. Actually, my husband's results were virtual as well. So we don't live in Gainesville,
Yeah.
and so it was very nice being able to do the telehealth visits, and not have to keep driving to Gainesville. But
Hmm.
overall, I personally have had great um, experience with getting feedback. I've worked with Alana a couple of times,
Hmm.
only because I am a obsessive compulsive worrier, and so I'm always asking for advice, and she's always been very helpful as far as setting up some time for us to talk and to provide that. So, and the testing only really took about a month to
Yeah.
get the results from the time we did the buccal swabs and sent them in
Yeah.
to getting the results back.
Yeah. So you guys are a good example of a family that's very well educated. And for you all, you were able to kind of understand the results. It can be really emotional for others. Maybe I should ask Christine and their family as well, and Susan, what your guys' experience with testing? Is it probably different a little bit? What was your guys' experience,
Well,
and decision to test and not test and how it
well, I
went?
just want to thank everybody who participated today. It was very informative.
Mhm.
Our yeah, our situation is similar and unique, just like everyone else's. Christine's family. Um, obviously, there's a history. Her grandmother's husband passed from Huntington's. Her mom and her uncle. And this ironically all happened when we first started dating when we were kids. And um, Christine was very upfront and honest with me about her situation, and that was wonderful.
Mhm.
As a 24-year-old, I had no idea what she was talking about or really what any of it really meant. I was able to meet her mother a few years before we got married, and she had symptoms at that point, and her grandmother, Christine's grandmother, who probably did a lot of the raising of Christine, um, you know, she said to me, "Don't have children," and um, and again, just I don't understand why these people are telling me all these things at the age of 24, 25.
Yeah.
But we were fortunate. We lived very close to Yale University, and we actually, our first time talking about getting tested was probably in 1996. And we went up to Yale, we did the testing, and the doctor, I'll never forget this for as long as I live, the doctor sitting there with a manila envelope saying, once I diagnose you, I can't undiagnose you. And back then, you know, the issues of not being able to get disability insurance and things like that, and the fact that Christine was very healthy at that point, we both decided let's live our lives not knowing. So we actually got up and left the office and never got the results.
Wow.
So life goes on, and it was probably about 2016 when I was probably sitting on a couch similar to this one, and I see out of the corner of my eye toes start to move, and all of the memories of the little bit of information I had at that point about facial movements and Korea and all that. And in 2016, when I started to see that, it was really a pit in my stomach, and we just lived with it, and we didn't talk about it, and we pretended it was whatever. We didn't pretend anything because I never really had the courage to discuss with Christine what I was seeing as her husband. And
Totally
then
different to the other one.
finally, it got to the point where it was unavoidable. The symptoms were not only physical but cognitive as well. And one night I just, honestly, I'll just be honest because it doesn't hurt in this forum. I broke down in tears and because I was processing all of this. And so eventually we decided to get tested, and we did that. We're in the Tampa area, so we did the initial testing at USF, and we were officially diagnosed in October of 2018. To say it was a life-changing experience is very much of an understatement, because it certainly has changed the way we live and the way we think about life, and the fact that we don't take days for granted anymore. So obviously, if I had a choice, I wouldn't want my wife to have this. But I think in the immediate time frame, it's kind of given us a little bit more of an appreciation of life and how to enjoy ourselves every day. So I don't know if I answered the question perfectly, but
you did great. You did great. I think yours is very different. And I think you expressed a lot of things that are not uncommon among some patients. Susan, I wanted to ask you, because I think your husband's a little bit more mature and older, and I think the testing was done later.
Yes.
Tell me about your experience, and how
Yes.
you guys learned about the disease.
Well, very, very different to the other two. We'd never heard of Huntington's. When Alan had some surgery in 2012, he had balance issues. And he was going to a balance doctor, and nobody suspected anything like Huntington's. And of course, at that point, we'd still never heard of it. And but the balance doctor, or then he had surgery again in 2015, knee surgery, and the balance got worse. And so we got sent to Mayo. And it was just one thing I said when they were kind of looking at him and seeing things. And they said, has he always walked this way? And I said, oh, he walks just like his mother does. And that kind of clicked. And they asked us all about his mother, who'd had lots of issues. We never knew what was wrong with her.
Yeah.
And of course, she never got tested, but we now realize she did have Huntington's. Mayo actually said straight away they knew what it was. And we had the testing that day. And we went back 3 weeks later, and they said, yes, he's got Huntington's. And the funny thing is, we didn't really take it very seriously, all right. So he walked funny. We didn't know anything about it. And I remember going home, and Alan said, they seem to be very concerned about this. But, if I'm walking funny for the rest of my life, so what? It was when we got home and we started reading about it, and then the realization of what he'd got then set in.
Mhm.
And then obviously we read that it was hereditary. We have 2 children, a son and a daughter, and 5 grandchildren.
Wow.
And in fact, my son is actually sitting here in the room listening to it all. He has chosen at this time not to be tested, and neither has my daughter, for the very reason that there really is no cure. That, once you find out about it, you do have to realize that there is a future there that you have no idea what's going to happen. But as the children have got older, the parents are now concerned about the grandchildren. And we have one who's autistic and has some very different issues. And so we do worry a little bit that there may be Huntington's there, but he's not old enough to have testing. And of course, if he has got it, then it means my son has it. But neither my children show any signs of it. And Alan did not show the signs until he was 60. He has a CAG number, I think, of 36. And for a few years, it was just balance. And he went to work until 2015. And it's only in the latter years, he's now 78. And in the latter 5 years, it has progressed a lot, both physically and mentally. And obviously now I'm a full-time, for the last 5-6 years, I've been a full-time caregiver. And, but would I have wanted to have known earlier? Actually, no, I wouldn't. I don't think we would have made the plans, obviously, from my accent. Both of us came from England. And Alan and I did say, as we saw the disease progress, had we have known what was coming, we probably would have never have, gone abroad, left the family. And had we have known what was wrong with Alan's mother, which we saw progress at the very end of her life, we would have made very different decisions. As it is, we've had a good life, but now my big concern, as I can't remember the First Lady's name, concerned about children and grandchildren. And I know we're very unlikely to have missed a generation, but that's where we are. We are older, and I'm thankful that it did not show until the latter years.
Yeah, each of your experience and coming to this diagnosis is very unique. And I think your story is very touching and it is scary. And like you're saying, really can't put it back in the box once you know.
No.
And the impact on family. This is it's not just a diagnosis of your husband, your wife, it's everybody and the impacts. I did want to ask you, Susan, if you can tell your husband is in more advanced stages, and I wanted to
Yes.
ask you about, as a caregiver, the challenges you're facing. It's maybe hard for others to hear, but the challenges that you're facing with your husband in more advanced symptoms, needing more and more care, um, and how you're
Yes.
coping with those increasing care needs.
Um, I considered I thought I was going to be a real good caregiver.
You are.
But I find caregiving, as it advances, it can be a lonely life, even though I'm surrounded by family, friends, a church. I've got a lot of support, but the day to day, it's always the same. From the moment I wake up, I know the routine, and it goes on and on. And after 5, 6 years, I'm tired of the routine. I do have help 3 times a week. My family say that I need it more, and I know I do. But that's only part of it. And also, as I could eat more easily with the body deteriorating, but it's now the mind.
Mm.
And I'm definitely lost the man that I knew and I loved. Still love, but we do not communicate the same. He knows who I am, but his short-term memory is almost non-existent. And he, he needs a lot of physical lifting, and that has taken a toll on my body. And so
Yeah.
I'm having to deal with that too. There's lots of different issues. I mean, you asked me what's for one, and there
Yeah.
are a dozen things you have to deal with, and each day is different. I actually dialed 911 a couple of weeks ago to have him, help lift him up
Yeah.
after he'd fallen in the bathroom, and they actually knew who I was. which tells you which
Yeah.
tells you a lot. And I'm going, oh
Yes.
my gosh. I don't have any problems with him eating. This man, you talked about nutrition and everywhere. Alan eats nonstop, although he has lost some weight, but he has no bother eating. I got a lot out of your was it Lisa who talked about apathy?
Yeah.
Alan was, a go-getter, always on the go, got a brilliant brain, and he's apathetic about everything. He can't be bothered with anything now. Doesn't want to read, watches the same TV programs. Nothing interests him. And that's the biggest thing that I feel now at this moment I'm struggling dealing with.
Yeah. I will comment just, I mean, your story is very unique and touching. I will comment that dementia does add another side to apathy, whether I do know that some patients struggling with dementia, sometimes they don't have the ability to be creative and
Mhm.
have the same mind to think of things to do. And so sometimes it's as the mind generates and people have dementia, sometimes it's necessary for caregivers to help be the one who's creative, to find things to do, to stimulate them.
Yes.
It's a little bit different, I think. I'm going to actually ask Christine to talk because I'm not going to put you on the spot. Sorry about this, but apathy motivation's been something that you guys have struggled with as well a little bit, and um, you've got some solutions. But can you talk just briefly about that?
Yes,
It's a
yes.
little different for you. Do you mind?
Not at all. Thank you, doctor.
It's challenging.
It is very, yes.
Yeah, it's
I
real.
learned about apathy during the diagnosis process. We had an extended education on the disease and the family history. Like we kind of understood a little bit, but without having testing, without having the knowledge that people bring to you that you do now, we got a lot and we had a lot of support, which was great.
Yeah,
But I remember at the beginning learning about apathy, but I also have anxiety. So I didn't know if it was anxiety or Huntington's. But lately, I don't want to go anywhere. I don't want to leave the house. I cancel appointments at the last minute. I change my mind. I put everything off till tomorrow. Everything that you guys said about it is what I'm experiencing in like real life every day. I know it's very frustrating for my husband, but we just had a visit with Dr. McFarland and we talked more about it and we talked more about some solutions and that the lady, I don't remember, I have a short-term memory issue too, honey, but I don't remember who that was, but that was a great couple segments today on what to do to help better that with a routine. Now we'll write things down. We'll set things up daily and some of the things that I've been missing out on that I really want to participate in, like going to church and maybe playing some games at home by myself when my husband works, because I stay home. So, some of the
Yeah.
advice today was really good. So we'll take that. I wrote it all down and we'll take that to him and I probably have time tomorrow to go over it.
Yeah. Michael, I'll let you, do you okay talking about your side of this
Yeah,
in
I
front
mean,
of your wife?
yeah.
This is frustrating.
No, I've talked to you a little bit about this. I always feel uncomfortable as a caregiver, really speaking my mind in front of Christine, because the last thing in the world I want to do is convey that anything about her is a burden. I want to stay positive.
Right.
I feel like almost like a cruise director sometime, saying, we're gonna have dinner at 6 and we're gonna go out at 7 and we're gonna do this and that. So I feel like, and I guess when what do they call it? Like silent suffering. I could be having the worst day at work. As soon as I walk through the garage door, boom, I'm positive, because I want her to feel as positive as possible. But, as caregivers, the apathy part of it can be contagious in the sense that, sometimes I won't want to do things that we used to do because it's not, I don't, I don't get the pleasure out of it that we used to. Worrying about her falling up the stairs or whatever it may be. Sometimes it's easier to stay home, and put the television on or rent a movie or something like that. And, people don't, outsiders don't really understand that. And they're like, well, why don't you do this, and this? And I don't have an answer for them. And sometimes, if I were to tell a stranger, let's say somebody at work, that, oh, I had to cook dinner and clean up the kitchen, they'd be like, well, I do that every day. What's the big deal? But it's different. It's not that I don't want to cook or clean up the kitchen or pay the bills or whatever it may be. It's just, for the majority of my life, I've always had a partner that would help me with those things.
Yeah.
And it breaks my heart that the participation is becoming less and less on her side. And so I don't care if I have to wash dishes. It just upsets me that I have to, because, my partner can't do some of the things she used to do. And that's the heartbreaking part for me is, the cognitive, the withdrawal, all of that, I mean, Christine used to run this house like she was a Marine, and I used to get out of here. And, so the roles have obviously shifted. And, listen, I don't view, like, I'm sad that I have to deal with this, but, it really has brought us together in so many other aspects. And I'm trying to remain positive about that for as long as possible.
Dr. McFarland,
Please, Marcia.
if I can interject, I call myself an anticipatory caregiver because I'm not there yet, but I've done so much, way too much investigating, what a caregiver needs to do. And it just keeps consistently coming back that the caregiver has to take care of themselves. Because I've watched family members who have allowed their physical, their mental, and their emotional, personal selves be harmed by being full-time caregivers. And you have to kind of go into this with the philosophy that you're important too. And sometimes that's the hardest thing to do, is to say, you know what, I've got to go be me. And that's hard. I mean, it's hard, and I'm not even there yet. I'm not with you guys.
Yeah, the difficult part, and not to cut you off, but and you're not the first person to have said that. I've sat on many shrinks couches, and they tell me that I need to, live a certain way for myself. But I feel so guilty to do anything by myself out in the world without her, because I don't want her to think that I'm not enjoying myself at home, which I am, but I do understand it's important for me to go out once in a while with coworkers or whatever and enjoy myself.
Hmm.
But the guilt I feel, um,
It's real.
it right, and
Mhm.
like, and I've read all the books, I've listened to every therapist, and I just can't shake some of the feelings. I have the playbook, but executing it to me is almost impossible.
Yeah.
So I'm working on it. I assure everyone, but very difficult
Yeah.
when you're dropped in the middle of something that you have no idea what to do.
Yeah.
Yeah.
And
Susan,
I have to,
you're shaking your head. I know you had some ways of dealing with this, but yeah, go ahead and give us you too.
um, and I know exactly what they're both saying, and I agree that it's hard to carve out time for oneself. But now, after nearly 6 years, I'm learning, and I've had to learn the hard way, that I have to make time for myself. And sometimes it's hard, though, to get people. Alan's at the point now where I can leave him for an hour. I go for a massage every 2 weeks.
Mhm.
I've started now carving out a couple of hours at lunchtime. Some weeks when I have the caregiver, having lunch with friends. I think it gets to be very, very important for the caregiver
Mhm.
to have some outside interest. See, I'm no longer working. I retired in 2020. And so I'm home all the time. And that can be very difficult because, as you said, you can get very apathetic too. Yeah, I actually prefer sometimes just to stay home because it's too difficult to get it all organized to go out. And so, I'll just skip it. And my doctor and my pastor have both told me that I mustn't do that, that I have to get out. And it's as good for him as it is for me. But he's getting very dependent. When I go home, first thing he says to me, whoever is there, is, "I am so glad you're home. I missed you."
Mhm.
And he's become dependent, but that's because of the physical disability as well as the mental. And he's still there. He's still got his personality somewhat, but he's disinterested in most things that go around. And the one thing he has become, I have two friends of his come in once a week, and he will actually sit and talk with them. I don't know which one of the ladies spoke about it. He does better one on one. I
Mhm.
take him to church on a Sunday, they blank out.
Yeah.
And the one thing I have to do when I take him out, though, is just not overcompensate for him. I want to make everything just right. We have a lot of issues as a caregiver to get over. We get a lot of information about how we should do it all, but it's very hard in practice.
Yes.
Yeah.
Yes.
You're absolutely right about overcompensating because when we go out with another couple or a group, I can never relax.
No.
We're all chit chatting because, we'll be having a conversation about something and someone will say a word that triggers something in her head and she just runs with it and completely takes things off topic. And it's slightly comical, but it is one of those things that as it's been diagnosed since 2018 now, and I would say we do a lot less social
Yeah.
activities with other couples and things like that. Not because I'm angry at them, but because they just don't simply understand um,
Yeah.
Huntington's, and I don't expect them to. But the reality is it certainly has hindered a lot of our social interactions with other couples and groups.
Yes.
Yeah.
Yeah. It is hard. And, I hate to say it gets harder as time goes on. And I hate to be negative about that, but that to me, there's been different seasons in it. As I say, first time I noticed it was 2012. So we've been going a good few years, and I've seen the different stages that he's been in, and each one is a new adjustment as a caregiver, because it's, you know, it's your life as well as theirs, and you're living this together. And we've been married, what, 57 years. So, you know, we have a lot of background, and I thought that might make it easier, but caregiving is very, very difficult. So I do feel for you all, because I know that this does not get any easier. But we hang in there.
Yeah.
And I always say, have to remember, I've always been a positive personality. So I have to remember the cup is half full. And, and find something good in every day I do with him.
That's great advice.
Yeah.
We could talk about this for quite a long time. I know, I know. Each one of you is a hero in your own way. This is very difficult disease. I want to maybe not or finish maybe more of on a positive a little bit. I want to ask Christina and Michael about you guys participated in research trials, actually a couple of them. So I wanted to ask you about that. You know, tell me about your experience with the trials. What made you decide to participate in research? What did you like, not like? What would you tell other patients about participating in a research trial?
Well, I mean, coming into this, knowing that, you know, at least when I was first introduced to Huntington's, I mean, the idea that there was no treatment, there was no,
Mhm.
there weren't a lot of physicians working on it and things like that. And so to fast forward to 2018 when we were diagnosed, you know, the amount of research that has been done has been so encouraging. And, you know, when you find out your wife is diagnosed with something as horrible as this, why wouldn't I want to participate in the trial? I would have flown anywhere to find help. So the thought of participating in a trial was an absolute no-brainer for me, speaking only for myself, because I wanted to get her anywhere I could for help. And the wonderful part about trials that I didn't know at the time, but you know, looking back, it is a placebo effect in the sense that if we're driving to Gainesville for treatment, she mentally feels like $1 million, because it's the idea that, okay, you know, we have a team of people helping me. I'm going to get better. I'm going to get better. So the times that she's in the trial is the most positive times throughout the duration of the diagnosis. So I don't know who's listening to this, but if you can qualify for a trial, do it. I think it's great. Number one, you're giving back to future generations of HD patients.
Yeah.
Might not help us, but you know, hopefully eventually it does help other people. But I think from, you know, the fact that we're participating in a positive manner in something makes us all positive. And
Yeah.
there's so much negativity around this disease. When you can find something positive to hold on to, you do. So
And there's hope, lots of hope.
Yeah. Christine, you participated in a trial, I believe that required multiple visits, a lot of visits and a lot of treatments and testing as well. Um, you can go ahead and be open. I don't mind you telling me. Was it easy, hard? You know, what can you tell a fellow patient about having to come for like maybe a monthly treatment, being stuck with needles and all those odd assessments that we do?
Well, Dr. McFarland, first of all, just say, so I'm 54 years old, and my mother died with Huntington's at 50. So we lost her dad, we lost her brother, and we lost her. None of them were 50 years old, and some of them even younger. So they didn't have the gene then, and there was not a lot of if there was research, you never heard about it. If there was going to be medicine, you always thought that this was awful and there was not going to be medicine. And it had a very negative disease. Everything about having the disease was very negative and very worrisome and scary because you don't know. Like, you know medicine, but people who don't know medicine, it's very scary when your loved ones have something you don't understand. So I got diagnosed at 40 something. I just turned 54. So 46, 47, 40, terrible with my memory. But anyway, I got diagnosed before I was 50. And to me, the idea, I got diagnosed and like we took the pill, we did the blood in like August, and in October I found out. And I was in my first drug trial with you in December, with you and Kyle. And it happened so fast. And to me, I just felt there was so much hope and there was so much possibilities and the potential that there could be a cure or a drug to help you with the chorea and or whatever, because my uncle and my mother and all of my grandfather were very sick, all very young, teenagers even, they were already sick, young adults. So the idea that there could be some medicine to help us was so inspiring to me and so hopeful. And I personally felt through all of this, even though it wasn't easy, even though I did give blood that I hate, and I had to do all these tests over and over and over, this and this 117 times. But I believe that there's a reason why we're doing it, and if it's not to help me, then it is to help someone else with Huntington's.
Yeah. Well, how did you feel when you found out, obviously, your particular trial it didn't meet its input. It basically failed. Were you disappointed? Were you upset? I mean,
very, very disappointed, very upset. We were so hopeful that I was going to get cured and I was going to get a new brain, like we're just like all hopeful about all these changes that were going to happen with everything that I'm experiencing, every symptom I have. And then, you go through this every day and the grinding and the medicine and all the tests and all the follow-up and the appointments. And then, you're so positive because everyone around you is positive there, especially research people or, good people, doctors and everyone are good people. And then you end up getting this traumatizing result and you think it's got to be because it's Huntington's, because there's more money for bigger diseases, like cancer and
well, so you came back for more. So even despite the failure, so I'm gonna let you in this, but basically tell other patients like why should you do trials? Some are gonna fail. They're not all gonna work. There's been some positives now, but it's taken a long time. So tell me your guys, like, what would you tell other patients about participating, like, and doing it or not doing it?
It makes you feel like you are in control of something that you have absolutely no control of. You can, my memory is really bad. You know that, Dr. McFarland. So
You're doing great.
I just think when you see a team of people all working together to help yourself or your wife or whoever it may be, you probably don't appreciate what that means for people in our situation. So when I can drive up to Gainesville and I see, 10 people in a room all working on Christine, it kind of makes us feel like we matter, and that this is important. And it's important not just to the people who have it, but it's important enough to folks like you and the research teams around the country. And I'm going to participate. Well, we're going to participate in everything we can do. Number one, obviously, I want to save my wife. But number two, I don't want anyone to experience what all of us on the phone are experiencing.
Yeah.
And hopefully someday we won't ever have to have a Zoom call like this.
Yeah.
Yeah. Put us out of job. Well, listen, I'm gonna have to cut us off a little bit, so we can go for a long time. But first, I want to thank each of you. If you have a last word you want to say, we're gonna have to move on to our next panel. But thank you so much for taking your time out of your day today to do this.
Thank you for
Thank you.
asking.
Thank you.
It was
Thank
a
and being
you.
personal
pleasure.
about it as well and sharing.
Thank you.
Thank
You're
you.
welcome. Thank you again, you all.